There are many medications on the market to worm birds, but the one I recommend is Moxidectin. It provides good clearance of roundworms and hairworms, is very safe and easy to administer, and has the handy side effect of killing any external parasites that feed off body fluids. This includes all mites. The dose of Moxidectin 2 mg/ml for the flock is 5 ml to 1 liter of water for 24 hours. This dose is based on normal water consumption. If for one reason or another bird's water intake on that day is low, the drug is safe enough to provide for a second or a third day to ensure that all birds receive an adequate amount. If some birds receive a double or triple dose, this will do them no harm. It is important that the water containing the Moxidectin is mixed freshly each day. However, and that, of course, no other water sources are available. Moxidectin can also be given to individual birds at the dose of ½ ml per kilogram as a single dose orally. Tapeworms have a more involved life cycle. The adults, which live in the bowel, pass packets of eggs in the droppings that need to be eaten by an insect to become infective. Chickens can only become infected by eating insects carrying the tapeworm larvae. It is often possible to tell if a chicken is infected by tapeworms simply by looking at the droppings. Moxidectin Plus. Category Anthelmintic. Active ingredients Moxidectin, praziquantel. Guaranteed analysis Moxidectin 2 mg/ml, praziquantel 18.8 mg/ml. Available sizes 125 ml. Directions Flock treatment: dilute at the rate of 5 ml to 1 liter of drinking water and make available to the birds for 24 hours. The solution should be made fresh prior to use and provided in a clean drinking vessel. Remove all other sources of water. Individual bird treatment: 0.25 ml per 400 grams, pigeon, body weight. Notes: Moxidectin Plus is a fully water-soluble palatable syrup. Added to the drinking water for 24-48 hours, it clears roundworm, Ascaridia spp, hairworm, Capillaria spp, and tapeworm, cestode, infection. It is also effective against all external parasites that feed off body fluids, including mites and pigeon flies, Pseudolichia spp. Moxidectin Plus also eliminates airsac mites, Sternostoma spp, Cytodites spp. It has a wide safety margin and is safe to use during racing and breeding. It does not affect feather quality and is safe to use during molting. Moxidectin Plus does not cause nausea, and so the birds can be fed and loft flown normally during treatment. Not to be used in birds producing meat or eggs for human consumption with holding period, 5 days. Storage: store below 30 C, room temperature, in a dry place. Parasites: worms and mites. Give Moxidectin 5 ml/liter for 24 hours, or if tapeworms are a concern, Moxidectin Plus 5 ml/liter, or better still because the product is bitter, 1/4 milliliter, approximately 5 drops, to each bird. Ensure the loft is particularly thoroughly cleaned after treatment, as droppings passed prior to treatment can reinfect the birds. Lice. Lice do not feed off blood, like mites, and so the Moxidectin is not 100% effective when given orally. To eradicate lice, a dip can be prepared using permethrin. To prepare a dip is simple. Add 120 ml of permethrin plus 1 cap of baby shampoo to a bucket of water. Alternatively, Moxidectin can be added to the bathwater at 1/10 its oral dose, i.e. 1 ml/2 liters. This works really well and makes getting rid of lice really easy. Moxidectin will kill all mites on the birds and most lice. To eliminate all lice completely, the birds are dipped in permethrin solution. This is a good idea anyway, as it has a 4-month residual effect and provides good long-term protection against the insects causing problems during breeding. It is also a good idea to spray out the nest boxes with permethrin before pairing. Mosquitoes carry pigeon pox, pigeon flies cause irritation, anemia, and are associated with wet nests. Mites breed in the warm conditions of the nest box, and all other insects, particularly slaters, carry tapeworm. Therefore, before pairing I always spray with permethrin. Reference: Dr. Colin Walker. A single Moxidectin treatment produces slow death of adult worms in birds and dogs, and sterilization of worms in cattle. Compared to ivermectin, Moxidectin has a considerably longer half-life in plasma, 20 days compared to 2 days, allowing for the possibility of either less frequent treatment, or higher efficacy with similar frequency of treatment, compared to ivermectin. It is effective in animal worm infections that are resistant to ivermectin. Moxidectin is a fermentation product from Streptomyces cyaneoglycius spp non-cyanogenous. Chemically it is related to other wormers, the ivermectins, but instead of a disaccharide side chain it has unique methoxine and dimethylbutanol side chains. They are basically related chemicals from Streptomyces bacteria, but some studies reckon Moxidectin is safer than ivermectin, and the one above reckons Moxidectin remains active in the body 10 times longer than ivermectin, 20 days versus 2 days, and that kinda raises questions on the claim that one dose of ivermectin keeps a pigeon pest free for a year? Search is made by Raymond Julian, Canada. External parasites of pigeons. The importance of external parasites of pigeons is often overlooked by pigeon fanciers. By ignoring the importance of these parasites, the pigeon fancier runs the risk of disease and poor performance in his pigeon loft. The treatment of these parasites is often controversial, with many myths, lies, and misunderstandings being promoted by unscrupulous vendors or poorly informed fanciers. This article is intended to give the pigeon fancier the true facts about external parasites in pigeons and to announce an extremely exciting new development in the treatment of external parasites of pigeons. The importance of external parasites of pigeons. External parasites are grouped into 3 main groups, namely lice, mites, and flies. Pigeon lice. Pigeon lice live their whole life on the pigeon. They do not suck blood but live of the bloom and feather debris. Once they are established in the loft, they will multiply rapidly, and one pair can produce over 100,000 progeny per month. These organisms are not known to carry any diseases, however they lay their eggs on the quills of the pigeon's feathers. They may also cause mild irritation as well as excessive preening that may cause feather damage. They are a sure sign of bad husbandry in a pigeon loft. Pigeon mites. Red mites, Dermanosus gallinae, live in the cracks and crevices in the pigeon loft. They only move on to pigeons during the evening to suck blood. These mites cannot be detected during routine inspection during the day. To identify these mites, balls of cotton wool must be placed into nesting bowls and onto perches in the dark, collected in the morning and then inspected for the typical small red mites hide inside the cotton balls. Red mites cause skin irritation, scaliness, and anemia. Heavy infestations may even cause the death of squabs. Blood-sucking lice may also transmit pigeon pox, as they will feed on more than one pigeon. Feather mites also suck blood but stay on the bird's feathers and are seen as black crawling dots after taking a blood meal. Depluming mites penetrate the base of the feather shaft, causing severe irritation and causing birds to pull or break off feathers. Quill mites enter the shaft of the feathers and cause a fine brown discharge as they suck blood. These mites cause a weakening of the feather structure with breakages of young feathers. Nasal mites found in the nasal cavities and cause severe irritation within the sinuses. Constant sneezing, nasal discharge, and rubbing of the beak are observed. Scaly leg mites live under the skin and scales of toes, feet, and legs of pigeons, causing scaly accumulations and roughening of the skin. Pigeon flies. The pigeon fly is commonly referred to as the jockey of racing pigeons. These flies look almost like ticks with wings attached and live most of their lives on the pigeon. They have specially designed hooks on their feet that help them to move rapidly over and under the pigeon's feathers. These pigeon flies are blood-sucking parasites and will often fly from one pigeon to the next, taking blood meals as they go. They lay 4 to 5 larvae in any organic material. It is claimed that they inject a toxin that causes mild diarrhea in babies to enable them to lay their larvae around nesting boxes. Pigeon flies are the major transmitters of pigeon malaria, Hemoproteus. The extremely negative effect that pigeon malaria has on the racing performance of pigeons is well known. The constant blood sucking by the pigeon fly will also cause anemia and will further reduce racing performance. They also cause severe irritation in pigeons with feet stomping and constant overpreening. This constant irritation will sap the energy levels of pigeons and further reduce racing performance. It has also been shown that they may carry pigeon lice from one pigeon to another. The transmission of pigeon pox from one pigeon to another is also possible. From the above, it can be seen that the pigeon fly is of major concern and every effort should be made to eradicate these parasites from the pigeon loft. The importance of external parasites of pigeons. When treating external parasites, it is important to take the life cycle and feeding habits of these parasites into account. It is also extremely important to use the correct products that have been tested and developed specifically for pigeons. All of the products used for eradicating these parasites are toxic. If the incorrect product is used, or if the wrong dosage is used, pigeons will be poisoned and will often even die. The use of products registered for cattle, sheep, and dogs should be avoided at all cost. These products often contain organic phosphates or chlorinated hydrocarbons, which are extremely toxic to pigeons. The pyrethroid-containing products are the safest for pigeons and have the broadest spectrum of efficacy against all the external parasites of pigeons. However, the pyrethroids made for cattle and sheep should be avoided as the carriers and the strengths of these products are developed for cattle and sheep and not for pigeons. The ivermectin type products have the distinct disadvantage that they are only effective against the smaller type of blood-sucking external parasites of pigeons. Ivermectin has no effect on pigeon lice, tapeworm or roundworm, and the efficacy against pigeon fly is highly suspect. It is often claimed that these ivermectin-containing drops will kill the internal and external parasites of pigeons. This is a gross overstatement of the efficacy of these products. The concentration that is absorbed via the skin of the pigeons has not been proven, and thus the efficacy against other internal parasites of pigeons still needs to be scientifically proven. The use of dips, powders and sprays has been the traditional method of treating pigeons for external parasites. When using these products, it is imperative that the lofts also be sprayed, as some of the parasites live off pigeons. Special attention should be given to any cracks and crevices in the loft, and the area around nesting boxes should also be well treated. It is important to clean the lofts daily and to remove all fecal material, especially around the nesting bowls. Pigeon flies will often fly to nearby compost heaps or areas where there is an accumulation of organic material and lay their larvae in these areas. Such areas should also be sprayed and cleaned. Avian Insect Liquidator is the ideal product to use for spraying the lofts and surrounding area. This product contains one of the newer and safest perethrins, and is highly effective in killing the adult stages of external parasites. It is very safe to use and may even be sprayed on babies, as well as in and around nesting bowls. Avian Insect Liquidator may also be used very effectively to spray or dip pigeons. The pigeon should be thoroughly wet after spraying. The use of other sprays, dips and powders not specifically made for pigeons is strongly discouraged. Carbaryl-containing powders are not very effective, and especially the pigeon fly is not eradicated when treated with powders. A new breakthrough spot-on formulation. The use of dips and sprays in dogs and cattle has for the past few years been almost completely replaced with the newer spot-on formulations. These spot-on formulations are much easier to use and are also more effective as they spread evenly across the hair by way of unique formulations. Currently, there is no such pyrethrin spot-on formulation available for pigeons. After extensive research, such a formulation is at last available from Medpit. This product, called Ectomed, was specifically researched, developed and tested for pigeons. It contains one of the newest, safest and most effective perethrins called flumethrin. It was imperative for us at Medpit that this product be proven to be effective against pigeon fly as well as mites and lice. Provisional laboratory tests confirmed the safety of this product. Even at 10x the recommended dose, no serious toxic effects could be seen. This increased dose was repeated after 4 weeks and still no toxic effects were seen. Even more amazing was the fact that the pigeons treated at 10x the dose had no abnormal blood tests, proving that the pigeon livers and kidneys were unaffected even at this high dose. The only mild side effect seen was a transient diarrhea and irritation at the site of application that passed in 24 hours. Provisional laboratory tests also confirmed the incredible efficacy of Ectomed against external parasites. Especially encouraging was that the product was highly effective in killing the dreaded pigeon fly. The pigeon flies would still move around on the pigeon, but within a few hours of application they would become sluggish and later would drop off. Within 24 hours all the pigeon flies had died. Field trials done on 2 lofts where there was a particularly high infestation of pigeon flies were very effective, with the total disappearance of these flies within 48 hours of treating. To effectively and safely treat all external parasites of pigeons will now be as simple as parting the feathers at the back of the neck and applying 3 drops of Ectomed with the easy-to-use dropper bottle.